All right, everyone. So now we have switched places. I'm behind the camera and Miss King is in front of the camera. This is Angela Jones King. She is our clinical coordinator / dental clinic manager. And take it away, Miss King.
Okay, my name is Angela King. I will show you my office first. This is my office, and our hours of operation are posted outside of each office. And this is Miss Danielle Guillory's office here, and the same. And we also have a mailbox outside, so if people want to put different information inside, they can do that and not disturb her.
And it's in a secured location.
And it's in a secured location, is keyed as well. This particular board is our Golden Scalar Award. This is our award board. So all of our students are very excited when they get their names. I call it putting it in lights. But with the Colgate Star Award and the Academic Excellence Award and all of the awards are kept here. So for those lucky winners. And I will just introduce our clinic. So as we first enter our clinic, we do have different signs on the outside of the clinic door. We have the caution X-ray in use before you even walk in the clinic. And all of our very nice faculty are listed here, Ms. Guillory being the program director, and our 3 doctors and all of the staff that we have here. And we have part-time faculty as well. I want to introduce you to our dental materials lab. We have 12 chairs and the dental materials instructor. She meets with the students. Sometimes we show different videos. And the students don't necessarily have to wear the PPE during the videos, but all of the other times when they're in here, they do wear that. And this is our fire extinguisher. We also have the emergency fire blanket that's posted here. We have 2 fire extinguishers, and I will show you the other in our clinic.
Also, you might ask that we have 15 students, but there's only 12 chairs. Well, when we do have 15 students, we also make sure that we do a rotation, so that way everyone gets full time in the clinic lab.
So this is our clinic, and our clinic consists of, let me just introduce all of our faculty. All of their names are here and their credentials are here. So, and some of our instructors have the infiltration license as well as the RDH or the DMD certification. So that's where that's located. And these are the 3 sink areas, and each hand washing station has a designated sign. And we have the soap and the hand sanitizer, also the cavi wipes and whatever is necessary for this particular area, and the hydrogen peroxide oral rinse. That's from COVID, that's what they're asking us to make sure that our patients are utilizing. And also we have the eye wash stations. So I wanted to show you, we have 7 total, but this is 1, and we flush it every week. And these come off and we just flush it and let it just kind of run. And then here we keep tabs on the expiration dates. So all of these things are here, and we keep the sinks as clean as we possibly can. And so this is one of the ones that you can actually place your eyes over the unit. The others are mostly like this, except we do have 2 more that are like this. Every operatory, we have 12 operatories in this side of the clinic. Each operatory has its own cavitron, and the whole unit here, we've got the Pure Evac system as well.
And what is the Pure Evac system?
It's just a high volume suction as well. So that's always good to add more protection for our students and our patients. So this is one of those units, and this is our new Swerve cavitron unit. We're very excited about that. So, and it works really nice as well. And so this particular unit, we have the sharps container in every operatory. It is mounted. It has to be mounted, or it has to be pushed up against the counter. In this case, we have ours mounted. And we have the cavi wipes, or the different types of wipes that we have here. We did go through a pandemic, so some of the wipes were hard to get, but luckily we have ours now. And all of the garbage cans, they have no bio waste. That's what this particular container is for. We do have a designated bio waste container as well. So just going all the way through, each operatory has its own computer and its own mobile cart. They do share the x-ray equipment, so there are 3 per side, so that 2 operatories will share this particular unit. And so, and it opens up from both sides. And on the outside of each of the x-ray, we make sure that there's a caution sign that's posted for every one of those, which is very important to let people know that you need to remain 6 feet apart. So all of these operatories have different types of Cavitron systems as well. We also have our storage areas.
Oh no, Ms. King, the treatment sequence.
Okay, okay, there is the treatment sequence. And so everything is listed for the student in the exact order of which they should follow. Most of them follow it quite well. And so, but sometimes we do have to alter this particular treatment sequence based on different things and different timings as well. All right, so we keep our supplies against the wall. So any students that are grabbing their PPE and things like that, we have those stored in the cabinets that's against the wall. I also wanted to show you this air purifier. We have 2 of these, and it's a very large air purifier. Typically it's in green, and then if it turns to orange, it kind of lets us know that there may be too many aerosols, and then we kind of assess what's going on in the clinic and how we can reduce those aerosols as well. This is our fire extinguisher number 2, or I guess number 1 if you're looking at it in the clinic as well. We do have the view boxes, but we typically don't use those very often. And of course we have the fire evacuator plan that's posted here. Here, this is the board that students write on when they're needing to get an instructor. So this is the instructor board. And this is how we have everything just lined up when I'm Mrs. King, and if it was Mrs. Ryan or Miss Guillory, whomever is their instructor for the day, they would just write that they're ready for a check. And this is our defibrillator. It's our automatic external defibrillator. So anytime there's an emergency here, then we can utilize this particular one, and the alarm will sound when it's opened. But once it's open, we replace it as well.
If you see that green light that went off, that was an indication that the battery is good. And then how often does the dentist check?
They do that, I know, about 2 times a year.
The dentist checks it once a week. Remember, he goes around.
Oh, you're talking about that. I didn't know what you were talking about. I thought you was, okay, so do I need to go back?
No,
over
just
that?
so the dentist checks this once a week. She thought I was talking about when OSHA comes.
Right, exactly. And so, but our dentist, there's a book, a log book that the dentist checks it, and typically it's on Mondays or whenever the dentist is here. So if they're not here on Mondays, then of course they get that booklet on Tuesdays. And here is another unit. And we also keep different supplies that are locked, such as our models, such as bite models and things like that for class 1, class 2, just different,
Different
versions.
typodonts to demonstrate what the different malocclusions are.
Yes. And so again, we're just continuously walking here. And if we have puppets for children. We have a lot of the different things the different aids that we would give to patients. If any aids are here and given to patients, so I guess I'm done with that part.
Yeah.
Okay.
Looks good, nice and clean.
Yes.
Miss King keeps a tight ship.
All right. And just instructor information that's kept under lock and key is kept in these particular cabinets.
Well, and this also is where we house all the radiology equipment, as well as the dental materials and preclinic.
Yes.
And then, of course, as you can see, there is a lock.
Yes. And this is it's in a restricted area, but we open the door and our emergency oxygen tank is also in here and our supplies are kept in here. So students have to ask permission, and then we keep supplies in this particular area. And our oxygen tank is put outside of the door every week, every day that we have clinic going on. And this is the box that students put their patient information. It is kept under lock and key as well, so no other student can have access of going into this box but myself or Miss Guillory or any instructor, but typically right now it's just myself and Miss Guillory. And so all of their graded papers go inside of this box, and then I take the key and to record the grades.
This right here is the instructor's counter.
Yeah. And we're very excited with our new Plan Mecca machine, our panoramic machine, and it is here. And so it's just a really nice Plan Mecca machine that we have here. And also the cabinet, we keep supplies in the cabinet here. Also, we have the color code on the floor. The yellow meaning that is 6 feet apart. So we have to make sure that our patients are kept safe, and also the instructors as well. And we have another sign here to let them know that x-rays are in use. And we also have it on every one of these machines, and every button that you pick as well or have to push. We have different signs that x-rays are in use, whether they're pregnant or just not, you know, so we just have this particular sign. So
and this button is 13 feet away from the actual panoramic machine. So the student is twice as far away from it as they need to be.
Yes. All right. And we're going to walk you over to the sterilization area. We have the sterilization area color coded. So we have the red zone, and that is considered the contaminated area or dirty area. We also have the green zone. And
well, let's talk about the dirty area first.
Okay, so the dirty area, we have 2 ultrasonics. The ultrasonics cleaners are here and here.
You want to open that up?
Mm-hmm. And so we have the ultrasonic cleaners, a very large ultrasonic cleaner on both sides. And we keep the sharps container here just in case. And all of the products that we need for the ultrasonic or for this particular area are kept here, and they're all labeled. And this is the sink zone as well. And
where they rinse off the instruments.
Where we rinse off the instruments. And this is all a part of the red zone. So this was still the dirty or contaminated area.
And as you can see, she has in 3 different areas. It shows the students what each color represents and what they should be wearing as well, so they don't have any question as to what they should be wearing when they're in those areas.
Yes. And our mask mandate suggests that we have to wear a mask right now. So if you saw that it said no PPE or at least mask in some zone like the blue zone, now we have to wear the mask. So that I put that in there just in case of different protocols. So that the students will not get confused about when they need to have on heavy duty gloves when they're in the red zone. I put these purple ones because our gloves just happen to be purple, so we just kind of made sure that they had no qualms about, you know, what color or anything like that. So they can use any utility gloves or heavy duty gloves in the red zone, and that's all of this particular zone. If we're in the yellow zone, we do want them to wear masks, and we also want them to wear gloves. And this is the labeling zone. So if they have to label their bags or put the indicator, the steam indicator strip, they would place this inside of the bag. We write here, and of course we're using the Sharpies here. And this is our yellow zone. And the supplies that are needed are kept in the drawers underneath on both sides. Over here, we have our new, I guess it's new for the year anyway, it's our water distiller. It has helped us a lot so that we no longer have to purchase water, distilled water, but we can use that. And this is our biological test. So we do this once a week. And as you see here from last week, this one turned yellow and the rest of them should be all purple if our autoclaves and I can't even think of the name of it.
Statum.
Statum, I'm sorry. The Statum, all of these have turned purple, so everything is functioning the way that it should. We have 2 autoclaves, autoclave 1, autoclave 2. These are by Midmark, and we have 2 Statums here as well. And the signs, again, they just show you what you need to be wearing, and also how they have to label what comes out of the autoclave. So everything has to be labeled and checked off by an instructor.
And everything is laminated.
Yes. All right, and
want to go to the radiology area?
Yes. And we can go here to the radiology area. And we have signs again located all over and on the outside of the door as well. And this is the area, I'll cut on the light. Okay. And we have a waste receptacle in this area as well. And all of the supplies for radiology are here.
So this is our ScanX, where the students will utilize the ScanX. Over here we have the conventional film. We only use that in Radiology 1 when we're educating them on that, because the board still requires this. And so they only take one FMX on a type it on. But other than that, we use the digital sensors and the ScanX.
Yes. And the certification we keep posted on the wall as well for radiology. So just to let you know, we do have that, and it was certified.
So this is the dental assisting area,
This is our dental assisting area.
which we use as an overflow.
Yes. So there are 5 operatories in this particular area, and especially when we need it as an overflow, it's very helpful.
And this is, we were recently inspected by the Jefferson County Department of Health and we have our certificate of x-ray inspection that was done in, when was it, Ms. King? Well, it could have been April.
Yeah, probably.
Oh, January. It was January. So now they'll inspect it in 3 years.
Yes.
We have our notice to employees, lab policies and procedures. All right.
Okay. And this particular board, okay, well, we have everything that we need as regarding PPE or anything that students need. Emergency kit area, our spill response kit areas. So all of these things are labeled so that students know, or faculty know, exactly where these things are. If we happen to have an incident, we do keep the post-exposure method and documentation, the steps to take, just in case there is a needle stick, and what we need to do and how we need to proceed with care of our patients or our students. And this is a big overview of our clinic. We love our clinic, and it's very spacious, and so we're very grateful to be here. And thank you for giving me that opportunity to be your guide. I did want to mention that we have the maintenance request forms here. So if a student has a problem with their equipment, they place it on here, and they place it outside, either in the box that's keyed, or they can give it to me directly, and then we have to send in those requests to get those things repaired.
Then this is the second air purifier. So we have one at each end of the clinic, one in the front and one in the back.
Yes.
And that's all I can think of, Miss King. Anything?
That's all we can do. And also I did want to mention that our HIPAA documentation is kept in every mobile cart as well.
Oh,
And we
yes.
also have-
Did you want to pull that out of the...
Yes. Okay, and it's kept, and it's labeled for each operatory as well. And so all of this, the rights and responsibilities and all of these things are kept in every mobile. Okay, and a few other things as well for the student.
Little extras for our students to
Yes.
help them along.
Yes.
And then, of course, as you can see, there's a lead apron in every other operatory, because they share they share the lead aprons between each other. And that's all I can think of. And as you can see, all the computer monitors are facing inward, so as not to affect other people to be able to view paperwork. We also cover them with a protectant, which also prevents anyone from being able to view it. And
I think
anything
that's
else?
it. So we appreciate this opportunity, and we'll look forward to meeting you all and seeing you. Thank you.
All right. Bye. Thank you, guys.